Okay, good evening. Today we're going to teach back on very important topics, which includes the endocrine system disorders and, of course, your GI disorders, right? So, if I were to prioritize between the two topics, I would think that endocrine would be more important than GI, considering the fact that you're dealing here with the most common diseases that you expect to see, not only as in your work as nurses, but in the nursing board exam. So endocrine disorders, which do you think is the most common disorder that you have to become an expert because you know it will come out in the nursing board exam? Of course, definitely, right? It's a very common disease, not only here in the United States, but in the world. And therefore, we need to know exactly what is wrong in patients who suffer from diabetes, right? In diabetic patients, what organ is involved? Pancreas, very good, okay? So again, if you know your anatomy, there is not any question that you cannot answer. You will be able to answer every question that you will be able to encounter. So the pancreas is an endocrine, at the same time an exocrine gland. The difference is that endocrine glands do not have ducts, exocrine glands have ducts. What makes the pancreas unique is that it is both exocrine because of the pancreatic duct, remember? The main accessory duct of Wirsung and the accessory duct of Santorini. These are ducts that will release what? What do the ducts release? What? Perfect. Enzymes where?
In the blood? Where do they release? Digestive. Oh, digestive enzymes.
Yeah, where do digestive enzymes go?
In the intestines.
Okay, so this is where I can tell that you have forgotten your anatomy. Because you're confusing the endocrine with the exocrine component, which is fine, you know. Some of you took it 4 years ago, 3 years ago, and you come to this class and you say, okay, Dr. Adamo, you have to review us, okay? And that's fine, right? A duct, sweat gland, have a duct, sweat goes out in the skin pore. But in the case of your pancreas, the duct goes where? Esophagus, stomach, yes, Zanita? So I can tell this lady knows her anatomy, right? And the duodenum is the first part of the small intestine, right? Okay. The pancreas is here, the duct is there. Okay, so what is released to the, now let's see if you know your anatomy really, Zanita. The pancreas secretes to the duct what? Into the duodenum?
Pancreatic juice.
Juice, otherwise known as what? But what is in the juice that you are important for?
Enzyme.
Of course. Unless you know your anatomy, you will really be what? Lost. I'm not trying to put you down or something. I'm just trying to what is reality in this world of nursing. In nursing, the foundation is really what? Anatomy and physiology. Because you know what's normal, oh my God, you know what's going to be abnormal. There is no question that you cannot answer. These enzymes include lipase. What do they digest? Lipids or fats? Protease, what do they digest? Protein. What about amylase? Starch and carbohydrates, right? So that is what it is. When you put the food into your mouth, you swallow the food, process, you chew the food, it's called mastication. And then it goes into the esophagus, it's called what? Deglutition, you swallow it. And then eventually it goes to the stomach, the churning action of the smooth muscles will digest it. What for? Because you want the food to become what? Big particles or small particles? Why? Because what is the next step? It will be acted upon what? The enzymes here. If it contains starch, amylase. If it contains lipid, lipase. Right? You need lipase. Protein, protease. Now, once they are broken down, two things. There are two types of digestion, mechanical, smooth muscles, and then what? Chemical digestion. In chemical digestion, what do you need? Enzymes. Okay? So, once they become very, very small, the next step is what? What is necessary in the duodenum, jejunum, and ileum? What do you want to know happen next? Yes? What comes after digestion? Of course, I said absorption. Okay, did you get the discussion among the two of you? Very good. And what is absorption? Let's see. See? You might know the answer, but you have to explain to me. You have to satisfy me. Like if I were the judge in a court proceeding, Your Honor, you would say it's absorption. That you have to explain to me what exactly is absorption for the benefit of the people watching this court proceeding. It's called academic court. What is the definition of absorption? What's your name, my dear?
Irela.
Irela. What is absorption, Gabriela?
So when the particles go from the intestine to,
Where does it go? To absorb means what? The food goes where?
to take in.
Okay. Yeah, that's right. So you came up with the right answer, but unfortunately, you have to be able to what? To become smart in this world is to be able to know everything and answer all the questions. Because you have to be able to anticipate what will be thrown at you in the nursing board exam. I would really want everybody to be smarter than the book or smarter than me. Because why? Because that's the only way to become the best that you can be, right? Anybody who knows what's absorption? Yes. The father with a new baby.
So the absorption, it would be that whatever's get broken down is gonna go through the epithelial cells.
Yeah. What's next?
And
Which somewhere?
the hydrochloric acid is gonna.
Are you going back to the stomach? That's not, you're now in the wrong direction.
Okay, so now
we already came from there. Stomach is here, so we're now here.
Okay. So now we're gonna go to the small intestine.
Yeah, we are there.
We're
Okay,
there.
we have the villi here. You know the presence of the villi will increase what? Surface area, which is good for what? Absorption. So, but you have to tell me exactly in simple words. You know, remember the word KISS? Who made this famous? Me.
Keep it simple.
Keep it simple, student, right? So explain to me, I'm a grade 1 student. Father, what is absorption, father?
It is.
I'm your son. Oh, I'm really out of the focus, okay. Yes.
It is.
No pressure, okay? If you don't know the answer, I'd like to call a friend, okay?
Can I phone a friend?
It is not my intention. Some people think that I put down students. No, I'm not. I'm here to come up with an intellectual discussion because that is what we are here for, to learn, right? From you and from me. I can learn from you, you can learn from me. Yes. Are you a former student of anatomy? Who was before? Yes. Are you a former student? No.
No, but I can give it a try.
Okay, give it a try. Go ahead.
Do you wanna?
Okay, go ahead. You already raised your hand. You already acknowledged you. Yes.
So it gets the nutrients get absorbed.
Okay. So don't use the word absorb again.
The nutrients.
Okay, I'll give you a transfer to what? To where?
The liver. Isn't it? And then blood.
There you go. Who came up with the word blood?
Well,
Is it Sanita again? Okay, relax, chill. Okay, you have been given a chance, okay? So you are right. It goes to the blood circulation, right? Why? What is in the wall here? You have 4 layers. Remember the 4 layers? If you were my student in anatomy, surely, how can you forget the 4 layers, right? Okay, mucosa, submucosa, let's ring a bell, right? And next would be what? Smooth muscle. And then what is the 4th layer? Serosa. Mucosa has mucous membrane that secretes what? Oh my God, don't you love anatomy? What does the mucous membrane secrete? Mucus. Same thing here. Mucosa, submucosa, the wall, mucosa, submucosa, smooth muscle layer, and then what? Serosa. What does the mucous membrane secrete? Mucus. What does the smooth muscle do? Contract. So there will be what? Peristalsis. And in the stomach, there will be churning action which provides mechanical digestion. But what is found in the wall, particularly in the smooth muscles, there are what? Yes! Who said capillaries? And what's a capillary, my friend?
It's a really, really small.
It's the smallest what?
Smallest vein.
Huh? Smallest what?
Smallest blood vessel.
Of course, and what's inside a blood vessel?
Blood. Right?
So right now, 1 is equal to 2. Exactly, right? So we're getting somewhere, right? Somewhere over the small intestine. I'm not kidding. For you to know and get an A in this class, you have to know and get an A in anatomy again. If you did not get an A in the past, now is the time that you think virtual A. Get an A in anatomy because if you get there, then you get an A in this class, right? So essentially, the glucose goes into the blood circulation because it traverses the mucosa, submucosa, and the smooth muscle which has the blood vessels. And these blood vessels contain blood. The blood contains plasma and cells. So apparently, the food goes there, right? So you have to understand that that is where it goes. Now, when that happens, What does the pancreas do? The endocrine, so you have exocrine, the duct, enzymes. What about the endocrine component? It's called what? Islets of what? Langerhans, right? And these islets of Langerhans have cells. What does the alpha cell secrete? Okay, if you give me insulin, that means we are really in deep trouble because you're not getting confused with which cell, which one cell, right? What about the beta cells? That's the time you say what? There you go. What about the delta cells? Alpha. Delta. Yes? Delta, yes, been here? Delta. In your book, they always have a chapter on normal anatomy, isn't it there? They always review. Do you bother to review the chapter or just go directly to the chapter? Oh, she's smiling. Because why? You did not read, right? I like this book because it actually will review you what you're supposed to know, right? Every chapter, you talk about endocrine disorders, it reviews about the endocrine glands. GI tract, the digestive system review, right? Does anybody know? Yes? Delta cell? Begin with letter S, ends with N, yes? Somatostatin, very good. Okay. I would suggest you do what I do here. Do you have a whiteboard at home? Get one, pretend that you are me, and create your own YouTube videos and watch it every day. And then you can, because when you teach, you won't forget, hopefully. You will not forget. Because you keep on repeating the things that you're supposed to do, right? Okay, now, when you eat, the food contains sugar or glucose. Will it go to the blood circulation? What happens with the blood glucose levels? It goes up. For the simple reason because there is diffusion. What exactly is diffusion? Movement of particles from the area of high concentration to what? Low, right? So let's pretend this is a cell. It could be a brain cell, muscle cell, bone cell, whatever cell. Every cell is surrounded by a smallest blood vessel. What do you call the smallest blood vessel again? Capillary. Perfect. We call them tissue capillaries because these are tissues. When you have a group of cells, we call them tissues. So what's the name of this capillary? Tissue capillaries. If you see the muscle, muscle tissue capillaries. Bone, brain, same thing. So, when you eat, the glucose is here. Eat. Food contains glucose, G for glucose, G. Glucose goes here. There's a lot of glucose molecules here. In response, because of the transient hyperglycemia, normally it should range between 60 to 120. Anything below 60 is hypoglycemia. Anything above 115 or 120 is what? Hyperglycemia. So this would probably go up. If this were 60, it's 120. Okay. Your blood sugar goes above 120 to 200. 60, low, below. 120 to 200 goes up. What will be released would be what? Perfect. Where? Where? Now, because ducts are not present in the islets of Langerhans of the pancreas, the hormones are released directly where? Into the blood circulation. So you would expect the eye or insulin to be where? Here. Right? It's now in the blood. What for? In order to reach its target organ. What is the target organ of insulin? To all the cells. Right? Okay, now, what is this, class? A key to open what? The door. What is the key for? To open the door. Okay. You're familiar with the word analogy? A basis of comparison so that learning can be easier to understand. The key is I. What is I? The key. Now pretend that there is a door in the cell. How many doors? Let's pretend. Let's pretend there are 3 doors. 1, 2, 3. 1, 2, 3. 1, 2, 3. How many doors do I have? 3. How many keys do I need to open them at the same time?
3 and 9.
I have 9 doors, right? How many keys do I need to open the doors at the same time? 9. So, if this were the key, it opens the door. The door is in the cell membrane. It's what you call receptor. It's a receptor. Remember the word receptor? Rings a bell. The key, the groove of the key should match the doorknob. Can I use the other key to open that door if this is the key? You see the difference between the doorknob and this one? Useless key. I need this key. I open the door. I will attach to the receptor. This is I, a key. And I will open the door. And when the door is open, who should go inside the cell? Glucose. What for? Miss Acevedo, what for? Why do you need glucose should enter the cell? Yes, Miss Acevedo? Yes, your partner to your groupmate. They've been looking for you how many weeks now? Yes?
For ATP?
Okay, ATP is what?
For the energy?
Of course. It's the raw material needed for ATP production. Remember, the mitochondria, it produces ATP, but for that to happen, remember the Krebs cycle, cyclic carboxylic acid cycle, all the food we eat will eventually, you don't have to memorize the chemical reactions, just bear in mind, proteins, carbohydrates, and fats becomes pyruvate. Pyruvate becomes what? ATP, with the effect of oxidative phosphorylation with oxygenation. That's the reason why you need oxygen. Without oxygen, we all die. Because we do not have ATP. To produce ATP in the mitochondria, do you need oxygen? Yes, we do. To become maximized production of ATP. So oxygen plus food, glucose, you have ATP, right? We need this glucose to enter the cell. How many keys do I need?
9.
Type 1 diabetes mellitus. What happens now if there is no key?
You're in trouble.
If there is no key, am I in trouble?
Yes.
Will I be able to open the door?
No.
If I'm not able to open the door, what happens to glucose? Will glucose be able to enter the cell? There is no eye.
It stays in the blood
It stays in the blood. Why?
because it doesn't have any muscles to enter.
There's what?
It doesn't have. It's not going anywhere. It's not being
Because
used.
there's
There's no key.
no key.
Yeah.
And without the key, the glucose cannot enter the cell. And therefore, the glucose remains in the blood. And what happens to the blood levels? Will it go above 120?
Yes.
Is that called hyperglycemia?
Yes.
Is that one manifestation in type 1? In type 1, because there's no more time to answer my own questions from now on, it's autoimmune. In type 1, it means your own body, the immune response attacks what? The beta cells, precisely. The beta cells are destroyed by your own immune system, which means that these young children, or adult or young juveniles, it's when some people would have called this as what? IBDM, or juvenile, or young onset. Why? Because it happens usually in children and young teenagers like me. You don't understand. I'm just pretending to be 57. Actually, I'm only 12 years old. The bottom line, therefore, is these individuals have been exposed to any form of what? Viral infection, bacterial infection, and guess what happens? They develop an immune response. They develop antibodies. They're T cells and B cells. The B cells produce antibodies. So instead of attacking only the virus, what does the antibodies do when the T cell attack? They also attack what? The beta cells. And when you attack the beta cells, the cells are completely what? Destroyed. And therefore in type 1 there is what? Zero what? That's the reason why they're called insulin dependent. Because there is no glucose, there is no insulin, the glucose cannot enter the cell. Right? Do you understand? So, what do you think is the mode of treatment for this patient? What do I tell the nurse to inject the patient with?
Insulin.
Only. Treatment would be by injecting what? Insulin. Do you understand what I'm trying to say here? It's the only way we can treat people with IDDM. What about type 2? NRDDM. Two things. There is a pancreatic dysfunction. Little what? Insulin is produced, but there is still some insulin. So instead of 9, maybe we have what? 3. This is just an example, insulin. But would that be enough to open the door at the same time? No, we cannot. Have you ever been to a movie house? Where is my key? Oh my gosh. A movie theater, there is only one person selling tickets, and there are 100 of you. One person selling tickets, only one key. So all of you cannot enter the cell right away, the movie house, because there's only 1 or 2, 3 keys, right? But if there were 9 people selling tickets, all 9 of you can immediately enter the cell, because you have 9 of these. Here, there's little. What is the other problem here? Has to do with what? Receptor insensitivity. Sensitive. It is not sensitive. In other words, what do I mean by that? You have defective what? Receptors. So example, what did I say about this? I said that there's the groove. The same groove should match the groove in the doorknob for me to be able to open the door. If this is the groove here, and somebody will mess up with that, putting up epoxy or whatever, will it match? No. Will I be able to open the door? No, I can't. So that's the problem. The good news is that in these individuals, not all receptors are defective. Good, bad, good, bad, good, bad, good, bad. So even though we only have 2 or 3, then you can what? Allow glucose to enter the cell. But since they cannot go inside at the same time, because of these 2 problems, will there still be hyperglycemia here? Yes. Of course. There will also be hyperglycemia here too. But the treatment, can we also inject insulin for type 2? Yes. Huh? Can we inject insulin? Yes. Yes, because why? Little, you need more. Can I inject insulin too? What else? Can I give oral hypoglycemic drugs? Yes. Because what does these drugs do? They will stimulate the beta cells to produce what? Produce more or more? Because they have what? Little. Okay, let me move this camera here to further elucidate what I mean by this. Can you see the door, my dear? Could we please stand up? Take a look. Okay, think of this room as a cell.
Action.
This room is what?
The cell.
So this is what? What part of this of the cell? Cell membrane. How many doors does this room have?
1.
It's a fire hazard. There should have been at least 2. If there's a fire, we cannot hear, we cannot, we're all dead, be dead. I'm going back to the door. How many doors do I have?
1.
What is it? The cell. What is this? Cell membrane, cell membrane, cell membrane, cell membrane, a door. This is the blood vessel. What is inside the blood vessel? Blood. What's the name of the blood vessel? Capillary. Okay. My name is Dr. G. G for who? Glucose. That's the reason I'm always sweet. Okay, what's my name? Glucose. Okay, Dr. G for glucose. I am in the blood vessel. This is the door. For me to enter this door, I need what? What's the name of the key?
Insulin.
Okay.
Hey!
Yay! From the blood, I went inside the cell. It's okay, I don't mind. I'm already inside. I don't care. I'm already inside the cell. So once I'm inside, will the cell be happy?
Yes.
Of course. Now, what happens if there's...
No glucose.
Without the key, can I enter the cell?
No.
Where do I stay?
Outside. In the
In the
blood.
blood circulation. What happens to the blood levels?
Oh,
Of course. I can't go inside. Where's my key? I can't go inside because there is no to open down. And therefore I remain where?
In the blood.
Another glucose came in. Okay? You understand? Now, what's the difference between this one and this one? The reason why this is called type 1 because you have completely destroyed what? The beta cells. The only way to feed them is by giving them what? Here, little. It means that the beta cells is not maximum production. And one way is to give a drug, an oral hypoglycemic drug, that was, I'm getting old. That's to jump inside the room, already having difficulty of breathing. It's called exertional dyspnea. I think I'm suffering from congestive heart failure. I hope it's not left-sided because I'm doing the pulmonary edema. Okay? So, you can give 2 drugs, this and this. Now, what is the problem here? Because there is no key, the cell cannot get its glucose. What will be the alternate source of energy?
Fat.
Fat. Who said fat? You said. Okay, very good. Okay, what will be the consequence if the cell has to use an alternate source of energy? You produce ketone bodies. When you produce ketone bodies, only in type 1, you develop ketone bodies which are acidic. That's the reason why it's called diabetic ketoacidosis, which is what? A form of metabolic what? Acidosis. You will expect the pH to be less than 7.35, which is acidic, which we learned 2 weeks ago. Right? Do you understand what I'm trying to say? Okay? Is that clear? Now, what about in type 2? Do we develop DKA? No, we don't. It's called HONK. Hyperosmolar non-ketotic syndrome. What is hyperosmolar non-ketotic? Now, remember these. What kind of insulin do you have? Little. So whatever little insulin you have, will that be able to allow the glucose to go in? Even though it takes a longer time. Yes? So, is there a need to use fat as an alternate source? No! Why? Because you have little insulin which can allow you to let the glucose go inside. So you will not develop DKA here, only here. Type 1, yes, DKA. Here, what is hyperosmolar? Osmolarity means what? There is more what? Because not all the glucose can enter the cell, there will still be a long line of what? Glucose waiting to enter the movie house or the cell. Why? Because you only have little insulin. So the amount here would still be elevated around 180 to 200. Hyperosmolar. Why non-ketotic? Non means what? There is no ketotic production. Do you understand? Is that clear? If you have any questions, clarify now. Yes, Richard.
How does that lead to a coma?
Okay, I'll go into that. The problem is this, whenever your blood glucose level goes up, that above 120, and your blood sugar is so high, will that alter the level of consciousness of the patient? You know, in diabetic coma, that's the reason why we always have to monitor what? Blood sugar levels. It can either go very high, it can go very low. Right? So, diabetic coma, when your blood sugar is not properly controlled, and it's so hyperglycemic, it will destroy the concentration and at the same time affect your brain. Now, what are the 3 P's in diabetes? Both present here. Poly what? Poly what? Dipsia and then? Okay, polyphagia. What exactly do I mean by that? Remember, the glucose is not entering the cell. There's so much food, by the way. There's so much food. The only problem is that the glucose is not entering the cell. Right? Miss Nang. Miss Nang? Is she Miss Nang? Okay. Are you following us? We're busy on the telephone. Okay. Miss Nang? Let me see if you're following our thread, if it's our Facebook thread, or I know you might be on Facebook, have to be your friend. Okay. What is it that will be able to detect that glucose levels are low. And what is it in our body that is the appetite center? Now I will give you a clue. It's in the brain. You're missed now, right? You know? Would you like to ask your friend to your left? Huh?
Can you repeat the question?
Okay, my question is, if your blood sugar is low, the cell is not getting, the blood sugar, glucose is not entering the cell, there is one thing portion in the brain that is supposed to detect whether you're full or hungry. The cell is hungry. Why? Because the glucose is not entering the cell. What part of the brain is able to detect that? What is your name, my friend?
Bill.
Billy Zhang. Mr. Zhang? You know? Okay, the gentleman to your right. In the same. Huh? Keep going. Anybody who knows? Very good. Who's an hypothalamus? You're the man. You're hired as a nurse today, okay? The hypothalamus. So what will the hypothalamus make you think? Oh shit, there's no... The hypothalamus is the satiety feeding center of the brain and the body. Because the glucose is not entering the cell, the hypothalamus is made to believe, OMG, Dr. G, the cell is hungry. And what does the hypothalamus make you do? What is polyphagia? Increased desire to what? That no matter how much you eat, the glucose still cannot enter the cell. You might eat or drink 1 ton of sugar, but it is the hypothalamus that makes you think, oh my gosh, we need to give more glucose, but in fact it's not entering the cell, right? Now, what is polyuria? Increased urea. Do you know why? Okay, let me explain. I have no more time. Okay, would you like to try, Mr. What's your name again?
Israel.
Israel, the land of Israel, the promised land, to be able to redeem this class and be able to answer the question. Shh, quiet, please.
Is it because we said earlier about how the hypothalamus is sending signals, so you keep ingesting food, and that's why you urinate even more.
Okay, when food is solid, my friend.
I mean, drinking.
There you go. At least I'll teach you try it. I'll give you 5.
All right.
Okay, I will tell you why. What organ is responsible for wee-wee? That's how you answer, my friend. Going back to anatomy and physiology again. When you make wee-wee, what organ is involved? And what is the structural unit of the kidney? Who talked about this 1 week ago or 2 weeks ago? Was it me? Okay. I talked about the nephron last time, right? Okay. Let's review from this to this. Let me do it fast because I'm run out of time. The glomerulus, Bowman's capsule, the proximal convoluted tubule, right? The lobe of Henle, distal tubule, right? Okay. When you have high levels of glucose in the blood, will that affect the blood vessels in the glomerulus? Yes. Knowing that the glomerulus is a capillary, it is a blood vessel. Remember, renal artery, afferent arteriole. What comes after glomerulocapillaris? Efferent and what? Peritubular, what? Capillaries, then renal veins. One set of capillaries there, capillaries here. So what's happening? What's going to happen? Too much what? Glucose in the blood. What is again diffusion? From high glucose to low. What is now found in the urine, in the nephron? Sugar, right? If you remember the word osmosis, the more glucose molecules you have, the more it will attract what? Water. I see water. Water. Who will do that? Water. 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 What happens now? You have more water here. Where do you think the water will go? Up in the wee-wee? It's called osmotic what? Diuresis? I hope you learned this in your physiology class, right? Because the principle behind is osmosis. More water. Why would there be less water here? Because there is more glucose. In terms of concentration, from more water to less water, more water to less. Osmosis is defined as the movement of what? Water from high water to low. Why would there be low water concentration? Because you have a lot of glucose there. Why is it the glucose is found there? Because you have too much what? Glucose in the blood, it's spilled. Where? Remember the pores I told you about? Remember? I don't worry, I will not create holes here. This is your notes?
Yeah.
Don't worry. Yes? The glomerular capillaries, your holes? Because there's so many glucose, what happens to the glucose in the holes? It's spilled. In fact, if you don't believe me, do an experiment. Go to a hospital or nursing home with a diabetic patient, taste the urine. Oh shit, Dr. Gama was right. It's really sweet. I'm just joking.
Is that why your breath smells like candy?
That's ketoacidosis in the type 1. So the bottom line is this. No, I'm just joking. You don't have to do that. Okay, do another experiment. It's called Dr. Gama's experiment number 2. Leave the urinal of a diabetic patient overnight in the room. Guess who will visit that urinal overnight? Who? 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 Why ants? Ants love to what? Sugar. I learned it when I was in grade school. I never wanted to be a doctor, but I see the ants. What the heck is the ant doing to my grandmother who is diabetic? I was very observant. I was 8 or 9 years old. It must be sweet, so I tasted this. I'm just joking. I remember my grandmother had diabetes, and I would remember she would have these very small medications for her diabetes. So, if she has that, what are the chances of me getting diabetes? So, God forbid, our diabetes, that's going to happen. Yes, ma'am, you have a question?
I just wanted to make sure the classic manifestations are present in both of them, right?
Yes, because apparently high sugar, hyperglycemia, hyperglycemia. The only difference is the mechanism here. Here, zero insulin because why? All the beta cells are destroyed.
Yeah.
In type 2, receptors are defective, but at the same time, the beta cells are not able to produce enough. Little is produced. Now, where's the best place to inject? I will answer my own question now. Here. Why? Why? Yes, yes, my dear.
Wherever you have fat.
Why what?
Wherever you have fat.
Why? Your answer is correct. I love it. Why do you do it? What kind? Is it subcutaneous or is it subcutaneous?
Subcutaneous.
Okay, what is found in the subcutaneous layer of the skin? You see why anatomy can make you very smart? Epidermis, dermis, subcu. Epidermis, dermis. What does sub mean? Below the skin, cutaneous. What is found too much in the subcu? Fat. And what is in the fat that's very important? For it to be absorbed. For the insulin to be absorbed, you need what? Remember the word absorption? Huh? Of course! Don't you see the amazing thing? Are you excited about learning things that are you're supposed to know already? And now you know that? See? What is in the subcutaneous layer? Blood vessels, capillaries. If you were my student in anatomy, I made it very clear. Are there any blood vessels in the epidermis? No. What about dermis? Yes, but which one has more blood vessels? Hypodermis or subcutaneous layer. Will this come out in the nursing board exam? You will be asked, how do you inject insulin? Intradermal, IV, or subcutaneous layer? Now, why would you do it here? Okay, I'll answer my own question. Huh? Okay, uniform, not only because of the presence of fat. Not only that, uniform absorption. But you need to what? You said something. Somebody in that group said something. When you inject it, so what should you do? Stay in one side or rotate? Okay, I will answer my own question. Why do we rotate? Because if you keep on injecting on the same area, you destroy what? FAT. What is FAT? Okay, it's called what? Lipo what? Lipo what? Lipodystrophy. Is that a side effect of injecting in only one side? Is there therefore a need to rotate injection sites? Will this come out in the nursing board exam? Are you expected to memorize the different types of insulin? Fast acting, slow acting. Long act. Oh my God, the saliva is coming out from my mouth. Long acting, short duration acting. Miss Beverly Hills is laughing. Believe me, you have to study the different types of insulin. Okay, I hope you understand, okay? And diabetic foot care, very important. The way to cut the nails. Are we going to make them walk barefooted? Yes, if they want them to amputate their foot. And my friends who are vascular stroke will be very happy. More money for them. I'm just joking, of course. You want to avoid amputation because that's the thing that you don't want to happen. Okay, I think in your study guide, if you just study the study guide and make it understand that you come up, how many of you really read and make research on the study guide I gave you? If you do, you get 99% in this class. Now why do you get not? Why is it that you cannot get? Because you didn't probably get to study everything about the study guide, right? Okay, let's talk about adrenal gland. Although somebody will talk about this later, right? Cushing's versus what? Okay. The adrenal gland is also known as suprarenal gland. This gland is found on top of the kidney, right? So you've got supra above the kidney, right? And there are two hormones involved here. Two parts, adrenal medulla, and then what? Cortex. Medulla, you have the adrenaline, otherwise known as what? Epi and noradrenaline. Cortex, you have two. Glucocorticoid or corticosteroid, which is cortisol. And what does this hormone do? Glucose, increase what? Blood glucose when? If remember, the adrenal gland is for what? Stress. Which one is involved here? Why do you want more sugar? Because you can what? Run away from the building, you have more energy. There's a reason why your blood glucose should go up. In a sympathetic response, adrenaline, right? Okay? And glucocorticoids. Gluco, increased blood glucose. What about two? What is mineralocorticoid? Aldosterone. What does this hormone do? Two things. Sodium what? Retention and water what? Retention. And number three, potassium what? Potassium what?
Excretion.
Perfect. Now, if you know that, there is nothing that you cannot answer. In patients with Cushing's, the problem is high levels or low levels of the hormone? High levels. So, what would you expect to see in these patients with high levels of cortisol? Hypo or hyperglycemia? Hypo or hyperglycemia? Hyperglycemia. Blood sugar will be above 200, 120. What about your sodium levels in the blood? What is the target organ of this aldosterone hormone? The kidney again, right? It will tell the kidney to retain what? Water and sodium. If you therefore retain water and sodium in the blood because the kidney is trying to retain sodium, what happens to the blood sodium levels? Increase blood sodium. Do you understand? What is that called? Hypernatremia. What about water levels in the body? You retain water. Is that fluid volume overload or is that fluid volume overload? Because what does the aldosterone do? Make you retain water, and you have too much of that here. You have fluid volume overload. What about potassium? This hormone allows the kidney to excrete what? Potassium in the urine. So if the potassium is in the wee-wee, in the urinal, what happens to the blood potassium levels? High or low? Very good. And that is called hypo what? Hypokalemia. Do you understand? Now, what about Addison's? Everything is the opposite. If you have high levels here, you have low levels here. In Cushing's disease, there are peculiar manifestations. You have what? Humpback. What is that? Is it humpback? Or fat pants? Okay. Well, humpback, or it's because of the deposition of fat. Okay. What else? Truncal obesity. Big trunk, thin extremities. The effect of estrogen. The effect of steroids can also make their bones become what? Osteoporotic, developing pathologic fractures. And in women, because the adrenal gland can also secrete what? Androgenic hormones, they develop what? Hair, mustache, breast, but with hair. A woman with hair in the chest. Can you imagine that? What do you call it? Excessive amount of hair? Hirsutism. Hirsutism. You understand? Now, what about Addison? It's the same thing. Opposite. Except that now you have what? Will there be polyuria here? Why will there be polyuria? Because instead of retaining water, you will actually be what? Excreting water in the urine, because the kidney is not able to retain, because you have here low what? Levels of aldosterone and all these hormones. What about your sodium? Here you have what? Hypernatremia. What would it be here? Hyponatremia. What about potassium? Opposite. Why? Because you were actually not excreting it in the urine, you're actually retaining it. So take note. Now, to avoid confusion during the nursing board exam, what do I suggest you do? Memorize only one side. What are the chances of getting confused during the nursing board exam and you actually interchange these two? You're gonna be in deep stools. I don't want to use the word SHIT, because the treatment plan and management will be totally different. Who do you think will benefit by giving Dr. Gamos that gives 0.9 NSS? What is that? IV solution. Normal what? Saline or saline solution. Saline means there is what? Sodium chloride. Who do you think should be given that kind of solution? Cushing's or Addison's? Very good. You will pass the nursing board exam because you choose your smart brain. What happens if you say, I will give this to patients with Cushing's? You must be crazy. You're going to make it worse. The levels of sodium is already high. Why the hell would you give sodium solutions? You must be a graduate of a different nursing school. But because you're from West Coast, the best in the West, you know the right answer? What about banana, my dear? Where do you give the banana? What does banana contain? Huh? Potassium. Now, where do you give the potassium containing banana? In Cushing's or Addison's? Why? Because why? What happens in Cushing's? There is what? Why is there hypokalemia, Beverly? Your answer is correct. I want to know if you really understood what the hell is this guy talking about.
The potassium is excreted in the urine.
By what organ?
Kidney.
The kidney. And what is responsible for that? The hormone is?
Potassium. Wait, what?
What is the name of the hormone that's responsible for excreting the potassium by the kidney? From the adrenal cortex. Its other name is mineralocorticoid, Beverly. Did you copy my notes, Beverly? Now, some of you are not taking notes. These people are taking notes, fine. If you don't want, you have a photographic memory, I don't mind. I put here mineralocorticoid, right? I put here the word aldosterone, right?
Wait, mineral corticoid.
Is aldosterone, is the other name, from the word mineral, sodium and potassium. It retains sodium but excretes potassium. The answer is correct, but you have to explain to me why.
So that's what's causing the
Exactly.
accretion of potassium.
The high levels of aldosterone allows potassium to be excreted in the urine. That's the reason why the potassium in the blood levels are low. And that's the reason why we give what? Bananas here. Are we going to give a banana here?
No.
Again, you're going to kill the patient. And that is how you fail the nursing board exam. When you decide to give a banana here, why the hell would you give bananas when the levels of potassium are already what? High. In the 1960s, when I was a 9-year-old kid, I would watch the James Bond movies, Sean Connery, Russian and American spies. How do they kill each other? They kill by injecting with what? Potassium chloride solution. They put it in a syringe. This Russian spy will wear something like this with a stethoscope here, enters the door of the American spy, injects in the IV fluid, the what? And what will happen if you inject somebody with this? Cardiac arrest. And it is transparent. Now, oh my God, don't ever do this to your patients. Have you ever heard about the nurse killing 30 people?
Yeah.
It's crazy nurse, you know?
What happened with the ACTH level?
What are you talking about? What do you mean ACTH? You're talking about the, okay. Don't, okay.
Adrenal cortisol.
Okay, I know you're talking about, just concentrate on this first for the quiz today, okay? Don't overthink, you know? Okay. Now, hyper versus hypothyroidism. What are the two hormones there? Okay. Keyword is what? Cellular what? Metabolism, right? Okay. So, you have hypo versus hyper. Increase metabolism, decrease what? Metabolism. Which one will make you have tachycardia? Hyper. Like Graves' disease. What about hypo? Mixed edema. And you can also have mixed edema coma. This is found in adults. In children, it's called what? Cretinism. Now, metabolism of the cell needs to T3, T4 hormones. What cells? All the cells, including what? Bone cells. In hypothyroidism of children, they suffer from dwarfism. Why? Because the bones are not able to grow. Why? You need T3, T4 for complete metabolism of bones. They're dwarfs. Dwarfism is present. What else? Are they going to be mentally retarded? Because the brain cells need T3, T4. Learning is poor. What about in adult patients? If you're struggling on remembering things, if you think your memory is not so good, maybe your thyroid hormones might be low. So what do you do with hypothyroidism? You give what? Hormone replacement in the form of Synthroid or levothyroxine. Remember, T4 is thyroxine. Amazing thing, you lack thyroid hormones, what do you do to treat them? Thyroid hormone replacement, the synthetic form. What about gain of weight? Weight gain. I'm sorry. Yeah, weight gain here, why? Because the metabolism is low. Everything is slow. Everything is fast. Like what? Increased heart rate. Which one will have heat intolerance? Which one will have cold intolerance? Which one will have diarrhea? Hyper. Which one will have constipation? Which one will have weight gain? Very slow hypo. Which one will have weight loss? In the nursing board exam, they will ask you. A 60-year-old female patient was brought and diagnosed with a certain disease. Which do you think will need a blanket? Hypo or hyper?
Hyper.
Huh?
Hyper.
Why?
Oh, hyper.
See, if you answered hyper, you are in deep. Now, do you know that it only takes one question to either pass the exam or fail? Why do I know these things? Because even though I'm not a nurse, I reviewed nurses for 9 years in my illegal MTech review in my apartment complex.
$500.
How much?
500.
Exactly. 2002 to 2004, apartment. 2005, I bought a house after staying here in the States for 3 years. I stole all the money of these nursing reviewers. I did not, I might be in trouble with the IRS. I have 20 students, $10,000. Wink, wink. No, but I was poor at that time. I was teaching in a school called Casa Loma. They were the ones who brought me here from the Philippines to here. Anyway, it's probably not punishable by incarceration. Are we going to give hormone replacement here in hypo? Yes. What about here? It will make it worse. That is how, again, you fail the nursing board exam. If you do not know what to do with your patients. So when I tell you, every time you have 5 mistakes, you have killed 5 people. When I say 5 mistakes in a quiz or an exam, because the process of your mind is totally what? Packed out. I do not give hormone replacement here because the hormone levels are already high. But here I will give hormone replacement. What do I give here in hyperthyroidism? Zanita, you're an LVN, right? Who is an LVN here? They don't want to raise their hand, you know. You should be proud, especially if you have a license. Yes, you're an LVN, right? I remember. There's a selective amnesia. Who's an LVN? What do we give here for hyperthyroid?
Hypo.
Hyper. Okay, I'll answer my own question. Anti-thyroid medications. And what will this be? Anti-thyroid medications? Oh my God, there's a group assigned to this. My goodness, who is that group? Who is that group assigned to this? We will discuss it today. Yes, who is assigned to hyperthyroidism?
Hyper?
Yeah, is that your group?
No.
Who is assigned to hyperthyroidism? You'll be the first to report today if you don't raise your hand now. Yes. Somebody's assigned to talk about hyperthyroidism. Huh? You! Okay, what is the drug?
Anti-thyroid medication.
Yes. Hmm? Yes.
It reduces the...
Yeah, what's the name of that medication?
Oh, I didn't work on it.
Definitely not Synthroid, because Synthroid is the hormone replacement. Okay. Yes, is it propylthiouracil? Is it PTU? Is it there in your notes? Who knows the answer, the notes or you?
The notes.
Who take the nursing board exam, your notes or you?
Me.
That's the reason why you were assigned to be in groups. It's supposed to be a learning experience that you become experts on your topic that will be assigned to you. What does PTU stand again? My dear, what does PTU stand for? What does PTU stand for? She's still looking for it in. Come on, yes? Is it there? The one I said?
Yeah.
Oh, okay. They will be talking about propylthiouracil, anti-thyroid medications. Anyway, do you understand? Now, GIT conditions. I only have a few minutes, so. I would say the most problematic would be what? Stomach ulcers. Because they have a tendency to bleed. Right? Remember the layers? Mucosa, submucosa, smooth muscle, and then what? Serosa. What does the mucous membrane secrete in the stomach? The mucus is supposed to protect your what? Stomach wall against the effects of hydrochloric acid. But the problem in hyperacidity, there is more hydrochloric acid more than what? The mucus. And if you remember, the hydrochloric acid is secreted by what? Parietal or chief cells? Parietal cells. Very good. Janita? When did you take your anatomy, Janita?
GCC.
GCC. How many years ago? But you still remember. I like this woman. She remembers. Parietal cell, right? Together with the intrinsic factor, right? So, what will that do? Now, what is the name of the bacterial organism that is associated with gastric stomach ulcers? And that stands for what? H stands for what? Helicopter or Helicobacter? Helicopter. Is that helicopter or Helicobacter? Bacter means bacteria. Don't you love these things? Bacter, because it's a bacteria. Oh my God, I love anatomy already. And microbiology. Helico, because it's like a helix. And bacter, it's a bacteria. Helicobacter. Why pylori? Because the last part of the stomach is called pylorus. It's a game of words. Who said that? It's a game of relax, chill. Some of you, when you're taking the exam, you overthink. You give it so many, you think of so many things. Okay, this and this and this, and then you don't know what the answer is. Don't overthink. Just keep it simple, smart student of West Coast. If I'm at UCLA, say UCLA med students. Nursing student, West Coast. You're the best in the West. Remember that. You understand? Now, hepatitis. What organ is involved?
Liver.
Okay, liver. So liver is here. And this is what you're probably referring to, right? Liver is here, right? Upper quadrant. The food is absorbed here, right? It's called portal veins. This is a unique vein because instead of bringing the blood away from the organ, it brings blood to the organ. Hepatic vein, inferior vena cava. Portal vein, hepatic artery to the organ. 70% of the blood that goes here is actually passing through the portal vein. The portal vein is made up of the splenic vein, superior mesenteric vein, which comes from the what? The small intestine, and the inferior mesenteric vein. They form the portal vein, and then here you have what? Gastric vein and esophageal veins. What happens when you have liver cirrhosis? There's scar formation where? Liver. What causes scar or cirrhosis? Alcohol. So how many of you drink alcohol? Go ahead, continue. When you die, less one person in the world. I'm just joking, okay? What I'm trying to tell therefore is stop drinking alcohol if you can. If you need to drink because you're single and you want to meet someone, social drinking, drink with moderation. I used to drink for social drinking. I can drink one bottle of beer for 5 hours. That's how good I am in faking it, you know. Because I don't like the taste of alcohol. It's so bitter. I don't know why people like to drink. They just want to be intoxicated, you know. So I'm trying to be intoxicated. And then actually it's only, I'm a very good actor. I belong to medical fraternity, so all my brothers are drinking, with all those naked women dancing there. And I just go like this. Are we going home here? It's a race club. We have to study for tomorrow's exam. Studying the anatomy of the female body. I said, what the heck? So I close my eyes like this. Those were my younger days. Okay, anyway. When you drink too much alcohol, it will cause permanent damage called cirrhosis, scar formation. Another one is what? Hepatitis. Hepatitis A, B, C, D, E. A, B, C, D, E. A and E, how do we transmit them? Food, water. In other words, fecal, oral route. Food that is contaminated, water that is contaminated. Be my guest. I will share hepatitis A and E. What about B, C, and D? Why sexual intercourse? Because there's exchange of what? Body fluids. So always bring a what? The Gamodian condom. Okay? I'm just kidding, not that Trojan, Gamodian. Okay? My name. Joke only again. I plan to get it from China, India. I will change the name of Trojan to Gamodian. I will be a rich man. I don't have to be teaching anymore. Don't you like that? It also sounds Armenian, like Gamodian. You know? If you are not Armenian, but Gamodian. Okay. What else? IV. What else? Blood transfusion. Right? What about drug addicts who use contaminated needles? In fact, I believe in Holland or Netherlands, the government provides them with what?
Yes.
Needles? You understand?
But they're controlled.
Okay, do you understand? Now, so when you have cirrhosis here, scar formation, the blood was supposed to go here, right? The blood cannot go there. This is called the portal vein. The blood goes here, cannot go because there's scar formation, right? The blood goes back here. What happens to the blood pressure in the portal vein, Zanita? It becomes elevated. It's called portal hypertension. So when the blood is not able to go there, it will go to what? Area of least resistance. It goes back to what? The esophageal veins. You develop what? Varices. Like a varicose vein of the leg. The veins in the esophagus will become enlarged and distended. As the blood pressure is high and high, will this rupture and bleed?
Yes.
So can you vomit blood?
Yes.
Can you have blood in your stool? Now, what is there are two types of blood in the stool. One is black
And tarry.
tar stool. What is the normal color of your stool? Golden, yellow, brown. If you don't know, go tonight. Go to your restaurant. I don't want to taste it, but look, golden, yellow, brown. Now, if it's blood that came from here, or when you have gastric stomach ulcer bleeding, like this, it takes time to travel. It is black. What about if it's ulcerative colitis, ulcer in the colon with inflammation? Can you have bloody diarrhea? That's lower GI bleeding. Duodenum, lower GI bleeding. Above there will be upper GI bleeding. Okay? So the blood will be what? Fresh? It's called what? Anybody know? I'll answer my own question because there's no more time. The proctor is waiting for me now.